I knew that you received your undergrad from Syracuse and you majored in biochemistry and molecular biology, but you wanted to specialize in hematology and oncology. But somehow during your medical studies at SUNY, it led you down a different path to plastic surgery. Now, how did that come about?
Yeah, so at Syracuse University undergrad, as you mentioned, I studied biochemistry and molecular biology, and I was fortunate enough to meet the director of the Regional Oncology Center, and I was fortunate enough to do some research with HIV and human retroviruses. And because that's what he did, and he was the closest thing to a mentor, I figured that was my pursuit. And I was also interested in children, in pediatrics. It was later during my residency at SUNY Health Science Center in Syracuse, which is not directly affiliated with Syracuse University, that we were at the VA, and a good friend of mine who was my chief resident 2 years ahead of me was going into facial plastics. So at the VA, kind of anything goes, and I tease people and say we had the best looking VA in the country. We were doing facelifts and rhinoplasties and eyelid surgeries on all these guys, and they loved it. They were fantastic. But I really, that's when I made my decision to move in that direction.
Aw, I never knew all that. So you came to Cincinnati because you got a fellowship from the American Academy of Facial and Plastic Reconstructive Surgery. And you said that you had a new perspective about plastic surgery and what it could be that goes way beyond just the aesthetic aspect. Can you explain that a little bit more?
Yeah, well, so first of all, the residency that I did was in otolaryngology head and neck surgery. And so that's a number of disciplines from ENT, tubes and tonsils, to oncology, a lot of cancer and reconstructive surgery. And some of those surgeries, we would take other body parts like a fibula, one of your leg bones, to reconstruct a mandible, for example, if that needed to be removed because of a cancer. So there were a lot of reconstructive things that we did. One thing you might remember from Saturday Night Live was cone heads.
Yes.
Well, that's right. That's a real thing, and it's called craniosynostosis. And what happens is the sutures in your skull fuse, and you have misshapen skulls. You look like a cone head. And so, right, it's funny, but what's remarkable are some of the surgeries you can do for these infants to reconstruct that almost immediately. We worked a lot with cleft lip and palate, and so there were a lot of reconstructive things. So functional or reconstructive surgery is really the foundation for aesthetic surgery anyway. And I was very fortunate that we had deep training in all of those things.